the St. Vincent Access has seemed to make some improvements in the practice. Starting with the extended hours, I feel like patients have really come to appreciate that. Being at least in our practice, I'm practicing about 3 hours after normal business hours, so around 8 o'clock, and patients first are impressed that we're doing that, but again, really appreciate they don't have to take time off from work. They can be seen, be treated, be taken care of, and hopefully improved, and also we potentially avoid them trips to the immediate care and the ER where they're, again, thankful they're not waiting in the ER for hours. So again, they tend to be very appreciative of that, and then generally, especially when working after hours or on weekends, they give me a big thanks afterwards, just appreciating the care that we're giving them. For me personally, my satisfaction has definitely been improved, partially because I'm able to get my patients in a timely manner, being able to take care of them, feeling I'm making a difference in their lives. Also with the team-based care that we've done, I also know that my patients can be seen and be taken care of if I'm not there. I know I'm not stressed when I'm away, and again, they're getting good quality care by my colleagues. And that's definitely made me a little happier, less stressed, and made my practice a little bit better.
So as St. Vincent Medical Group began to align ministries across the state, we realized in our southern region that we had some inconsistencies that we hoped to align better with what had been working successfully in the central region, which inspired us to look at how we were accessing patients and accessing care. We were a little overwhelmed at first as how we would get that done. Thankfully, we found out there was a fairly successful access plan that had been put into effect, and we were able to use that plan to overcome some of the challenges to organizing the structure of what we would want our open access to look like and build on the successes that had been already seen and established in the central region. We realized that we had some pros in terms of our pediatric group having after hours, and it helped us identify our strengths and our weaknesses. It became clear that the flexible hours and same-day services were the two things that were going to be most readily able to be implemented, and so we focused on that to sort of capture those 2 points as our first success, and then to build upon that to move throughout the plan to the other layers of services that we need to expand to capture the full plan itself.
Patients love access. Patients love convenience. They love doing things on their schedule, and I think it's been really important that our primary care physicians have really worked hard to make that access available to them. So that access is available with open access during the days, open new patient slots, and extended evening hours. That's what patients really value, and it's the experience that the patients have with their physicians that really drives them to coming back. Our success as a healthcare system will be driven by our new patient growth and our growth of lives under care. That's a strategy that works under all economic models, be it fee-for-service or fee-for-value. And as we're in this very difficult transition phase, this growth of lives under primary care is very critical. The key to that is access. We have to make ourselves available for patients so that they can come when they want to be seen. If we're the system that has best access, then we'll draw more patients to us and we'll be successful in the future. We've done a lot of things in the Indiana market to really enhance access. So that's the same-day appointments, that's the extended hours, that's the centralized scheduling. What this has led to over the last 2 years is a 6 to 7% growth in lives under care. It's also led to a significant increase in patient satisfaction. And these two things will lead to our success in the future. I think that access is something that we're going to continue to work on and will continue to be a competitive advantage. We need to have multiple access points, and we're really excited about St. Vincent On Demand, which gives patients virtual access to a nurse practitioner or even a provider at multiple times during the day. I also am very excited about online scheduling, because at some point patients want to be able to schedule things just like they use their computer to buy things on Amazon or do other online activities. So the combination of multiple access points, multiple places for availability, St. Vincent On Demand, and online scheduling, I think creates a very nice package so that we can strategically balance what our patients need going forward.